Above all, there is no such thing like artificial ligament as it is patented by Wooridul Spine Hospital. It doesn't mean that other hospitals cannot use it. They can do, but I think there are some reasons for not being able to do it. I also have experience and training at a university hospital. I think the important reason is a lack of experience with the procedure. To be honest, I had no idea about the ligament reconstruction when I first joined Wooridul Hospital. At first, I was half in doubt when the procedure was performed on the patients with SpinalStenosis or even with worse conditions. But I am now sure about the ligament reconstruction as I see patients get better and their satisfaction is also high while treating them with it. It's different from what you've done yourself and what you haven't done. I have had the opportunity to perform surgeries and observe the progress of patients. I have come to realize that this is undoubtedly meaningful and effective. One more thing to mention is that patients can think that it is very difficult and a major surgery to make a large incision and remove as many parts as possible. But from our point of view, the most difficult thing is to preserve the parts that need to be remained as much as possible. As I said earlier, removing a significant amount of ligaments and bones in the posterior region and decompressing the nerves actually easier compared to ligament reconstruction surgery. Preserving the ligaments and the discs with minimal incision is actually the most challenging surgery. While the primary purpose of ligament reconstruction surgery is to reconstruct the ligaments, the first objective is to preserve as much of the remaining structures as possible. The more surgeries I perform, the more I realize the importance of being cautious and careful. Ligament reconstruction surgery is indeed considered a high level of difficulty. To perform the surgery with minimal removal while satisfying my own standards, I believe it would take approximately 3 years or more to master the technique. For these reasons, I personally think that other hospitals will be reluctant to do surgery. When I supposed to the patient to have surgery, they always said, "My friends told me not to have a surgery, it's right not to have back surgery." When I hear such comments, I respond by saying that they may not understand because they haven't experienced the pain themselves. Actually, if the back or legs hurt, it's difficult to walk or run. Daily life is not possible. Then, at some point, the motor skills decrease. This causes problems not only in the waist but also in the whole body. From my point of view, even if the patient is really old, it is right to do the surgery quickly even for better movements. Of course, trust with doctors should also be necessary. For those who suffer from back and leg pain, you can definitely get better. Even if people around you discouraging surgery, don't worry too much. I would recommend that you visit us for a consultation where we can discuss your condition and explore potential options for recovery. Thank you.